Today, we're going to talk all about why sex hurts and some of the reasons you might be having pain with intercourse or with intercourse attempts or with vulvar touching or any reasons like that. We're going to go through kind of what is the reason why this is happening for you. Okay? So, for those of you who haven't met me before, my name is Rivka Sidorsky. I'm an AASECT certified sex therapist and an AASECT certified sex therapist supervisor. And today's class is all about, giving you information about your body, and maybe this will answer some of your questions that you're going through about figuring out why is this happening for me, and give you some direction as far as treatment options and what you can do to get yourselves out of this problem. I specialize in female sexual dysfunction, pelvic pain, and couples and intimacy, and I see this every single day, the impact that painful sex has on women and men and couples, and it's just devastating. Sometimes it can really, really impact the not only the sexual relationship, but the emotional relationship, the intimacy, the connection. And I just want you to know there's treatments out there, there's help out there. And today we're just going to talk about a little bit about what could be causing this. And in a future class, we can talk more about how therapy can help you and what sex therapy does for pelvic pain. But for today, I'm just going to go through, some so that there's some understanding and education. Let's talk a little bit about the prevalence. You might feel like you're the only one out there that has pain with sex. It's not something that a lot of people talk about. It's, but it's a lot more common than you might think. About 20% of 21%, according to this study, of women experience pain with sex. And this can be because of a number of reasons. It is more common for women in their 20s. So we will go into some of the reasons why women in their 20s would have more pain with sex. Um, but I just want to share with you, that the statistics are showing between 10 and 20% approximately of women experience this problem. You're definitely not alone, and there's a lot that we can do to help you. To boil it down, there's three major categories of why sex would hurt. We have muscles, we have hormones, and we have nerves. Now, you might have problems with one of these. You might have problems with all three of these. And of course, you might be wondering, what does the relationship or anxiety play a role in this? Well, certainly there's a huge mind-body connection, and your anxiety plays a big role, especially on those muscles. So we can talk about that later, so that you understand the role that your anxiety and your emotional feelings play on your muscles. But when we're looking at this from some of the medical models, we're definitely seeing that you might have some issues with one of these or all three. And it's really important that you get to a doctor who can assess these three areas and help you figure out, are you experiencing hypertonic pelvic floor dysfunction? Are you experiencing tight pelvic floor? That means clenching of the vaginal muscles, of the muscles that are in the pelvis? Are you experiencing a hormonal deficiency? Um, and the tissue in your vulva is dry or brittle, or are you experiencing nerve pain? It's very important that you get to a doctor who can assess these three. I would say that the majority of my clients have gone to their gynecologist, a general gynecologist, and the gynecologist looks around and says everything looks normal. Okay. That is not an assessment of muscles, hormones, or nerves. I'm going to say that again. When the gynecologist looks around and says everything looks normal, they're not assessing muscles, hormones, or nerves. Okay? And that's why when you leave the doctor's office and they tell you everything looks normal, but you're still saying sex hurts, they have not helped you identify any root of the issue. Have they assessed you for vaginal atrophy? Have they assessed you for nerve pain? Have they assessed you for pelvic floor dysfunction? That needs to be a specific type of assessment. And when they look around and they say everything looks normal, what they're usually referring to is that anatomically speaking, there's nothing wrong or in the way. So what they see is that, the vaginal opening is open enough for a penis, or the hymen is, not intact, so it should be able to accommodate a penis. They're looking at structural issues. And so when they look and they say everything looks normal, that's what they're saying. But that's not an assessment for muscular dysfunction, hormonal dysfunction, or nerve pain. Okay? So we need to help. I want to empower you to really seek out that type of assessment when you go to the doctor. Did you know that approximately 10, according to this other study, 10% of women experience pain? Approximately 2 in 1,000 experience vaginismus, but some say that's a low figure. Now, what exactly is vaginismus? Vaginismus is pain with vaginal intercourse or penetration of attempts. So if you experience pain with attempted intercourse or with intercourse, that can fall under the umbrella of pelvic pain. Okay? Now, vaginismus refers to the fear and anxiety as a anticipation or as a result of penetration. So if you're the type of person who's sitting on the bed, the table at the gynecologist, and your knees are clamped and you're scooching up on the table, and you are clamping and tensing in anticipation of a pap smear, that is that fear and anxiety in anticipation that we're talking about. If you're noticing that in anticipation of intercourse or penetration of a finger, of a penis, of speculum, you are clenching and clamping down with fear, that is the vaginismus that we're talking about, the fear and anxiety with penetration attempt or as a result of penetration. Okay? Now, as a result of that anxiety and fear, what's happening on a physical level is the tensing and tightening of pelvic floor muscles. Okay? And what we're talking about there is if you're thinking about you are trying to hold in your urine, you're holding it in, you can't get to the bathroom yet, that clenching, that's what you're doing as a result of the anxiety. Okay. Sometimes this is more conscious than other times. So that is, sometimes you are very aware that you're clenching and that you're anxious, and sometimes you're not as aware. Let's talk about the anatomy for a minute. So this is a visual of the external genitalia, and then this is a visual of, the opening, just so that you get your bearings a little bit. When we're talking about the pain with intercourse, a lot of times we're talking about pain at the vestibule. Now, if you look at the open diagram, you'll see that the vestibule is the tissue around the entrance of the coitus, of the vaginal opening. Okay? That's the tissue there. And that tissue, that specific area is called the vestibule. And that it can be very, very hormonally sensitive tissue. Okay? So the tissue around it, or skin around it, might look perfectly normal, but the vestibule is very sensitive to hormonal changes. So if you are experiencing a hormonal deficiency, like with estrogen, for example, maybe this is due to birth control pills. Maybe this is due to menopause, postpartum, breastfeeding, certain acne medications. If you're experiencing a hormonal deficiency, the vestibule, the tissue at the opening of the vagina, can really show the results of that, and it can become very, very sensitive. And again, this is not something that with the naked eye you're looking and you see anything that necessarily looks wrong. But this is only with a proper evaluation of hormonal issues. Okay? If a doctor really is assessing you for pelvic pain conditions, they're really going to take a good look at that area, and perhaps use a Q-tip to assess, how sensitive is that tissue. But if you just look with your naked eye, it might look okay, because there's a broad range of normal tissue and normalcy. So I just want to help you see that, you might have gone to the doctor and they might have looked around and said everything looks fine, but did they take a Q-tip and really apply pressure to the vestibule? Did they assess that the entrance of the vagina is extra sensitive and perhaps has a hormone deficiency? Okay. So you might have pain in the vestibule. This could be hormonal. You might have pain in the clitoris. That could be called clitoridynia. You might have pain in the perineum. You might have pain in some of these branches, general pubic pain, pelvic pain, and that could be a sign of pudendal neuralgia. So depending on where the pain is exactly, and how large the surface area of the pain is versus how specific, will target your diagnosis. Okay. Sometimes when you look at the external genitalia of somebody who has hormone deficiencies, you might see a more thin or brittle um, uh, labia. Sometimes it might be angry and red. But it would take a skilled practitioner to really see, some of those things. So I don't expect, you to be able to tell this on your own. But if you haven't gotten the medical help that you have needed, try going to a OBGYN or a gynecologist or a urologist who specialize in sexual medicine or in pelvic floor dysfunction or in pelvic pain disorders. Let's talk a little bit about the muscles then. So now, if you have pain at the entrance of the vagina, then it's normal that the muscles will clamp up as a result of the pain on the entrance. Okay, so a lot of times people have both a nerve or hormone issue, and then it causes a muscle dysfunction. Okay, because the muscles are responding to the nerve or the hormonal issue. That's causing pain. So, if you think about it, if you have pain at this area of your, skin, then it could be that your muscles will respond as a clenching, as a protective measure, as a response to this pain. So this diagram is showing the pelvic floor muscles and how it is kind of a sling in your pelvis. And, with the penetration attempt, it can become impossible to penetrate. As you can see with the third diagram on the bottom, the muscles are so clamped down that penetration has become impossible. So this would be vaginismus. This would be hypertonic pelvic floor dysfunction. But the question is, what's causing it, right? We want to get to the root of the issue. Is this being caused by anxiety? Maybe there's lots of reasons why you might fear penetration. Maybe you had negative experiences happen to you. Maybe you are in a relationship that is unhealthy or scary. Maybe you had trauma or abuse. Maybe none of those bad things happened to you, but you have a lack of education, sex education, and you're fearful. Maybe, or maybe there's some pain on the outside of the vagina. And as a result, it really has some medical etiology. And as a result, your muscles have clenched. So do you have vaginismus and hypertonic pelvic floor only? Or do you have a nerve or hormone issue and the muscle issue? When a client comes to our office, in our evaluation, we want to help them figure out what is the root of the issue. Because you can do all the therapy in the world, but if somebody has hormone or nerve issues, then it's still going to hurt and your muscles are still going to try to protect you. So we really want to help you get to the root of your issues and address with medical providers, what could be some of those root causes. And then we're going to treat all the areas of issue. We're going to target those muscles, the nerves, the hormones, and of course, the emotional and psychological reaction and response. Now, one of the things that I wanted to share with you is that sometimes somebody does not have a hormonal issue or a nerve issue or a muscle issue, but they are in an unaroused state. And that can be uncomfortable to have intercourse. So I wanted to present with you that it is physiologically extremely important to have arousal before penetration. And let me explain to you why arousal makes sex more comfortable. Okay? In the unaroused state, if you look at that diagram, if you think about it, a dry sponge, the vulva is like a dry sponge. If you push against it, it doesn't give you a lot of bounce. It's brittle, it's dry, and it doesn't have a lot of squishiness. But what happens as you get aroused? What happens is you take the sponge and you soak it in water. Now, what happens with the vulva? It becomes engorged with blood. Vaginal lubrication begins. You have blood flow. The uterus elevates in the body. The inner two-thirds of the vagina lengthens and expands. The clitoris begins to engorge with blood. So all these physiological changes make sex comfortable, pleasant, and pleasurable, and not painful. Now you have more space for the penis inside, more width, more length, and the vulvar area has now become like a wet sponge. And so as you press against it, it's spongy and gives you a lot of nice bounce and kind of wiggle room, if you will, as opposed to the unaroused stiff sponge. Okay, so that's the process of arousal that is so important physiologically in reducing pain and increasing comfort and arousal and enjoyment and pleasure. So that is, I just wanted to educate you all that whether you have a pelvic pain condition or not, the there is importance, a strong importance in the function of arousal in reducing pain and increasing comfort. So if you have a pelvic pain condition, do not skip this. Don't discount this. This is an important intervention. And if you, of course, there's more, that you would need to do to work on this, but I just wanted to bring to your mind, how important it is that you don't skip arousal. Let's talk a little bit about vestibulodynia. You might have heard this word, okay? You might have heard or been diagnosed with vestibulodynia. That means pain in the vestibule. Do you remember how in the beginning we talked about the vestibule is the tissue on the outside of the opening of the vagina, right? And now that specific area has very sensitive tissue. And sometimes there can be pain right at that entrance. Now, again, that's not a muscle, right? That's the tissue. You might have heard or been diagnosed with hormonally mediated or hormonally associated vestibulodynia. Now, maybe this started as a result of taking contraceptive, birth control, hormonal birth control. So what happens is when you take hormonal birth control, this increases your sex hormone binding globulin, which means that you have less free testosterone and free estrogen floating around in your body, which means that your vestibule has less estrogen and testosterone as well. Okay? So now it could be that the vestibule is brittle and dry and angry and inflamed. And as the penetration attempts there, it's very uncomfortable and it could feel like sharp pain. It could feel brittle and it could feel like pins and needles. It can feel like daggers. This is the way it's been described, okay? Now, one of the treatments that we see for this and we use for this is that we stop the offending medication. So some medications can cause this, and then they usually prescribe some kind of a hormonal cream to the vestibule. And hopefully this works. And what happens is the vestibule becomes nourished and quiets down, and it becomes healthy tissue again, and quiets the nerve endings. and makes everything calm down. And as the penetration enters there, it's not uncomfortable, and it can that would be hopefully a treatment for that problem. Now, of course, if you have been diagnosed with hormonally associated vestibulodynia or hormonally mediated vestibulodynia, the muscles can be a secondary problem because you've had this other problem. So even if you treat the vestibule, the muscles can still be in a clenched state. Okay? So it's a great idea, if this is you, that you seek a medical practitioner who can really assess you and give you the right treatments. But then knowing that you probably would benefit from attention to the muscles with pelvic floor physical therapy and sex therapy to help you reprogram that, okay, sex doesn't hurt now. And how do I enjoy sex? How can I get over this anxiety and fear and the negative experiences? Um, that's something the sex therapist would help you with, because you can take away all the pain. And lots of women like this are still not able to um, have comfortable, pleasant sex that becomes pleasurable and orgasmic because of the history. So that's where sex therapy is works hand in hand with these medical conditions. Inflammatory vestibulodynia. So I have seen a number of women who have complained of recurring yeast infections or recurring UTIs. Now, sometimes these clients actually traveled internationally for like a study abroad or a Peace Corps, something like that. And what happens is that they are exposed to different like bacterias, maybe in the water or just in the ecosystem that they're living, the new place. And usually it's a very different habitat, like a third world country. Okay. And things are very different, and the water's different, and the climate's different, and they're exposed to different germs there than they're used to. So sometimes I'll have a client who says, I had recurring yeast infections or I had recurring UTIs when for 6 months or a year in this like period of time. Sometimes that can cause this inflammatory vestibulodynia. Okay. And there are medical treatments for this. And I just wanted to inform you that that can be a reason why you might experience pain. Another possible cause is congenital neuroproliferative vestibulodynia. Now, this is something that you were born with. Some of the individuals who were born with congenital neuroproliferative vestibulodynia were premature babies, and some of them are multiples. So those are some things that I've seen before, like twins or triplets. So sometimes if you were a preemie or if you were a multiple, it kind of increases the chance of this. Sometimes another sign of this is umbilical hypersensitivity is in approximately 60% of these women. So that means that if you press on the belly button, there's a sensitivity there as well. So that could be another kind of sign of it. Of course, all these things require a medical evaluation from a pelvic pain specialist. Okay. Somebody with congenital neuroproliferative vestibulodynia did not acquire this from taking birth control pills or certain acne medication or certain repeat infections, yeast infections or UTIs or something like that, or because of any kind of lifestyle issue, like you know, situations of, first intercourse or sexual history. This is something that they were born with. And but they're only finding it out later in life, when they've tried to attempt to use tampons or have a speculum insertion, or with a intercourse attempt. So people like this will be the client who maybe says to you that they always had pain with a tampon insertion, or they tried a tampon once and they shied away from it and they didn't try it again. So there was this emotional avoidance. Sometimes people like this, they know that there's something uncomfortable or painful down there, and they don't even try a tampon. Some people like this, they really avoid that region because it's not giving them pleasure. It's really giving them discomfort. So there's a lot of avoidance often. Um, Somebody like this, they might even get married and um, with without, you know, touching themselves at all, or attempting penetration of their own finger or of a tampon. And sometimes this can really be like a wishful thinking, that they, we're just really hoping that everything would be fine when they got married. But there was this, if you look back at their history and you really dive into it, there was some, kind of this avoidance of the area. So maybe on some subconscious level, they kind of really always knew that this is not an area that was comfortable and pleasurable for me. Um, this is the type of person where if you give them hormonal creams, usually this is not effective. This is the type of person where penetration of anything would be painful or uncomfortable. This wouldn't be, something where in sometimes it would be comfortable and sometimes it wouldn't, or sometimes it would be pleasant and sometimes it wouldn't. These are often people who describe always having pain. Now, sometimes they have more or less pain depending on how reactive their muscles are as well. So remember, we talked about that muscles can clench as a result of the exterior pain. So sometimes if they're on vacation and they're very, very relaxed, their muscles will be a little bit more relaxed, and sex might hurt less, but they usually express that, sex is always painful, and tampon use and all these other things, and this has always been a problem for them. Okay. So I'm going to skip over to, the pelvic floor dysfunction. So we're talking about that some people have some of these other medical conditions and pelvic floor dysfunction. Okay, that's where the muscles are tensing, or spasming. Sometimes they're weak, sometimes they're overactive. This would be something that a pelvic floor physical therapist would evaluate and help the client have more control over their pelvic floor muscles. Because most of the time, if you have any of the hormone or nerve issues, the muscles respond as a result. So you usually have both of those. So you can either have just the muscle dysfunction, which is the vaginismus, or you can have both. But usually if you have the hormonal or the nerve pains, the muscles respond as a reaction. So you usually have those both that go together. There's also pudendal neuralgia. That's another example of pain from the pudendal nerve. This is another thing that um, a capable sexual medicine expert would be able to evaluate you for. And again, if a OBGYN looks at your vulva or does a pap smear, They're not assessing for pudendal neuralgia. Another possible cause of sexual pain is lichen sclerosis. This requires, again, a medical uh, a look and a biopsy, but I just wanted to inform you that, this could be another example. There's lots of other possibilities, but these are some common things that we see commonly when we treat pelvic pain. And it's very important to us as sex therapists that we look at the whole picture. Like I said, we can do all the best sex therapy in the world, but if you have some of these medical conditions, you're going to need a team approach. You're going to need a capable doctor who's giving you the medical interventions, and then you're going to need the pelvic floor physical therapists who are teaching you how to calm the overactive pelvic floor muscles, and then you're going to need the sex therapist who's helping you recover the emotional, relational, psychological impacts that this has had on you, and help you reprogram a path towards pleasure and connection rather than pain and anxiety. For younger girls and women and teens, you're going to see more likely, you're going to have the vaginismus, pelvic floor dysfunction, vestibulodynia. So we talked about a lot of these medical conditions. I would be remiss to discuss, you know, a number of other of psychological contributors. Like I said in the beginning, if you might have had um, some negative sexual experiences in your past, if you're unprepared for the sex that you're having and you feel a loss of control, or you feel pressured, or you feel that, this is just expected of you. A lot of women have pain or discomfort with sex on their wedding night when they have uh, waited until their wedding night. A lot of times there's a lot of pressure to consummate the marriage. Not only that, but it could be religious pressure, it could be societal pressure, it could be pressure you're putting on yourself, it could be pressure from your husband, your new husband. And it's this very big deal to, consummate the wedding that night. That's a lot of social, societal, relational, psychological pressure. So that can cause dryness, right? We talked about the arousal being low. It can cause like a difficulty with arousal, can cause dryness, and it can cause your muscles to kind of tense, right? Um, of course, trauma, history of trauma or abuse. And I think, we can't underestimate the lack of just feeling prepared and understanding, what am I getting in myself into? What am I choosing? Do I want to have sex with this individual? What does that look like? Do I, really feeling prepared emotionally, having the education and information. Um, Now, and also relationally, we should talk about that. If I've had clients that come to me and they say, that sex is uncomfortable or painful. And when I ask them about their partner or their husbands, they say, that they fight a lot, or they don't even like each other, or that plays a role on how comfortable and relaxed you feel having sex with the person, which can cause pain when you're clenching, when you're bracing yourself, when you're guarding yourself, when you don't really want to be with this person, your vagina is talking for you. So your vagina is saying, no, no, thank you, or stay out, or putting up fences and speaking for you. Okay, so it's your vagina putting up these fences and these guardrails and saying, I don't really want this. So let's try to figure out why, rather than just kind of blowing past them, the vagina, right? And just insisting, no, I want to have sex. Maybe we should try listening and seeing, what is it that our vagina is afraid of? What is it that our vagina is trying to tell us? What concern do we have about the type of sex that we're having? What concern do we have about the person we're having sex with? What concern do we have about maybe the type of sex? Maybe it's in a position that you don't feel comfortable with. Maybe it's too fast. Maybe it's too rushed. Maybe it's maybe, there could be a number of things. So it's very important to consider that those are all factors here. Now you are going to see a higher prevalence um, of vaginismus and some pelvic pain in more religious groups. And like we talked about, there are some issues that go along with that, right? We have a pressure on virginity. We have a pressure to perform particular sex acts, and on specific time frames. Sometimes the pressure, the withholding sex that we're used to in the teenage years and up and going into marriage, sometimes the withholding sex makes it difficult to kind of all of a sudden embrace sex. So this might be something that resonates or not, but this can kind of sit in your body somewhere, and it might be something worth thinking about. I'm going to leave you today with a few ideas of 3 strategies that I know help. Now, a lot of these issues are not going to be solved without medical and professional help. But if you aren't ready to seek professional help, I would recommend these 3 strategies. 1, try to be as relaxed as possible, mind and body. Okay. So this means taking, a really relaxing bath or shower, trying to relax your muscles, trying to be very intentional about pre-sex relaxation. And also being mindful about how anxious or stressed you are. The more relaxed your body is, the more you will have less pain. Now, feeling in control, really think about, do I feel forced to have sex? Do I feel like I don't have a choice? Do I feel like I have to have sex for my husband? Do I feel like this is a marital obligation? Do I feel guilty? Are these reasons why I'm having sex? Or I'm forcing myself? Or I'm feeling forced somehow with society or religion or culture or by my partner to have sex? Are these some aspects? And really take a look at that. Do I want to do this? What do I want? And then arousal. Take a look at, am I skipping over arousal? Am I just trying to get this over with as soon as possible? A lot of people with pain, that's their strategy is, let me just try to get this over with as soon as possible, which is completely understandable. But like we talked about in the diagram, if you try to do that, you're trying to kind of have sex against that dry sponge. And that is uncomfortable and dry and brittle, and you don't have a lot of bounce and you don't have a lot of give, and it's scrapey. And imagine if you take a dry sponge and you just lather it in, you know, Vaseline. It's it is not, it's still a dry sponge. All you're doing is lathering it with Vaseline, right? So that's not going to solve your problem. What we want to do is we want to actually get that real arousal from within. We want to get the sponge to actually expand and be spongy and lubricated, and that's the arousal. So a dry sponge with slathered on lubricant is not spongy. So really the arousal is necessary. We talked about, just the importance of that, of the relaxation and not having fear-based pressure-based, stress-based approach to sex, but instead that we should feel that this is pleasant and relaxing and pleasurable. And of course, you might need help getting there. This is not something that is going to come easily when you have a history of pain with sex. You know, like I always say to people, if every time you ate chicken, you threw up, you would of you would not enjoy eating chicken. You would avoid chicken. You would have an aversion to chicken. You would have an aversion to the smell of chicken. You know, that makes sense. Your body makes sense. If something hurts you, of course you don't want to do it. Of course you would avoid it. Of course you would have low desire, low arousal, low enjoyment, right? Of course, you would not enjoy eating the chicken if you know you're going to throw up later. Of course, you're not going to desire eating chicken if you know you're going to throw up later. Your body makes sense. But the question is, how do we get ourselves out of this pattern? You probably likely will need some professional assistance, and I'm definitely here to just inform you that, you know, there are medical providers out there, there are physical therapists, pelvic floor physical therapists out there are sex therapists out there who are able to help you with this problem. So reach out to a pelvic floor physical therapist. They can help you with these problems. There are lots of medical interventions. For example, you know, you can use dilators to help practice penetration. There's lots of things that we can do to um, to help with these problems. There's tons of medical interventions, medications, creams. There's lots of help out there for you. And I just wanted to tell you that if you are in the areas that we work in, feel free to reach out to our practice for therapy. And if you're looking for a sex therapist in your region, you can look on the ASECT, AASECT website, American Association of Sex Educators, Counselors, and Therapists. That is a resource for you, or the IAPST, International Association of Psychosexual Therapists. That's another resource for you. You can reach out to ISSM, International Society for Sexual Medicine, or ISSWISH is another organization where you can find providers in your geographical area. So just know that there is help out there for you, and you're not alone, and this can get better. I hope you enjoyed the presentation today.